It's time for our health talk with Dr. Waine. Doctor, great to have you back on the show.
Thank you very much, Diane. I'm happy to come also this time.
So we're seeing an increase in dengue fever in PNG. Can you tell us what dengue fever is and what are the symptoms associated with dengue?
Yeah, it's just recently, I think last month and this month, especially in Mosby, there's a lot of people having this funny feeling. And they think that it's malaria, commonly thinking it's malaria or some kind of flu or what they call the upper respiratory infections. And oftentimes, they think it's this kind of malaria thing, it's a flu thing. But then, we realize that it's something else because a lot of times a lot of these people are very tired, fatigue very easily. They have headache and the feeling that the joints are aching or is losing. And, they want to sleep all the time. You get some headache when they're moving around, they see it as lights, having headaches. Fever is common things like malaria, not classical malaria type, but it's different. So it's one, they go and see the blood slide for the malaria and they can't find it, malaria parasites on the blood film or blood test in the hospitals. And the other three things that is seen is that the blood count that they do, they what they call the white cells and the platelets. It's low, it's low. So they're thinking, what's this? We have these symptoms, and it doesn't fits into malaria for the blood slides. It's negative. So now they realize it's dengue. So dengue, yes, if you specifically ask at the hospital to do a blood test for it, they do a blood test for us, dengue.
Okay.
In the hospitals.
And what is the treatment that you can take?
It's unfortunately unlike malaria, it's caused by a parasite. Dengue is caused by a virus.
Oh, okay.
So that's why you don't take antiviral. You don't take antiviral. That's the underside of it. So we try at the hospitals or at the clinics, we try to help people to help them or support them or treat them for the symptoms they come with. If it's a headache, for pain, muscle aches, joint aches, we give some pain medicines like Panadol. More often people prescribe for Panadol or paracetamol for those kind of fevers and headaches and joint and muscle aches. Other scenarios where people come in very, very dehydrated because they are not drinking enough, they're not eating enough. It's advisable for them to take more fluids. So at the hospital, we probably might put them on a drip, just 1, 2 of those drips, and then you can get discharged at the end. The other one is those other supporting things. The severe form that they come in with is bleeding. They have a tendency to bleed because, as I said, the platelets that control bleeding in the body, human body, it's very low, so your tendency to bleed is high. So they may bleed into those skins and they have some rashes stuff. So this is where it's severe, so we need to keep them in the hospital for a long time, like a week or so to get them recovered. So there's no specific treatment for dengue. There is no antiviral. You can take antiviral, but it's not advisable. More often times we give it for support symptoms.
And how long can it last for?
It can go for a week until your immune system, comes to. I understand the virus, and have some kind of immune cover for it. So it takes a while before the immune system to recognize that this is a virus, and so it probably produces on stuff to take care, antibodies. But until then, you probably like a week, 5 days, or a week, 7 days to get your treatment, and you're sick, with this. So in Mosby, I haven't heard anything about Ley, but Mosby, yes, we're having this. They said it's a outbreak, but maybe it's not reported at the hospitals. It's not done tests to confirm all these things. A lot of people think it's malaria or it's flu kind of symptoms.
Well, that's all we have time for today on the show. If there's any last words that you'd like to tell our viewers in regards to dengue?
It was never known before, but it's known. It's coming. It's a problem now. So people with malarial kind of symptoms or the flu kind of symptoms, it may not be flu, it may not be malaria. It is dengue then. So people need to go to the hospital to get blood tests to establish diagnosis, dengue test for it, and get the treatment before it gets into more severe form of the dengue. Like bleeding tendency, and you go into shock and all these things.
Well, thank you so much for being with us on the show today.
Thank you very much, Lion.